So in this video I will tell you what you should expect after a feminization laryngoplasty, a gender-affirming voice surgery. So once the vocal folds have been sutured together in the front to make them shorter so that they can vibrate faster and give you a higher pitched voice, you should be on voice rest for about 3 weeks. Absolute voice rest. You should not engage in any strenuous activity to prevent the vocal folds from pulling apart in the front. And once the 3 weeks are over, we can consider the vocal folds to be permanently stuck together and they're never going to come apart again. After an appropriate time of healing where the swelling of your vocal cords goes down, you will see that your voice will, from initially fairly hoarse, transition slowly to a more female-like voice. And once all the swelling is out of your vocal cords at around 3 months, you will have vocal folds that will vibrate just like a female vocal cord. You have to think about the vocal cords like a new string instrument. You will have to practice using the vocal folds correctly and applying a right amount of tension to those vocal folds. Those voice box muscles that sit around the vocal folds have to practice that. Sometimes a speech therapist can help you to do that. And you should also know that the range of your voice, speaking or singing voice, will be different. The lower range will be significantly reduced, and also the upper range can in some cases be reduced, but that is oftentimes a result of not applying the right vocal technique. If you apply too much force to the vocal folds, they will come together and they will lock, they will stop vibrating because you're applying too much muscle force, and that again is something that you can practice. So with the right vocal technique, you should expect a maintained upper range, but again the lower range will likely be reduced because